concept of disease in Srimad Bhagavad Gita and homeopathy regarding the origin of disease. To achieve my aim, the objects are to study the concept of origin of disease according to Srimad Bhagavad Gita, to study the concept of origin of disease according to homeopathy, explore and establish the connection between the concept of origin of disease in Srimad Bhagavad Gita and homeopathy. I choose to study design in fundamental research. Study the chapter of Srimad Bhagavad Gita. It's taken in verses 62 and 63. Study of lecture on homeopathy philosophy by Dr. J.T. Kent, lecture 18th and 19th. Study the analytical correction between the concept of origin of disease in Srimad Bhagavad Gita and homeopathy. In homeopathy and Srimad Bhagavad Gita, disease originates from corruption of will and understanding. People get syphilis because of their own action that expose them to the disease. The concept of miasm in homeopathy aligns with the teaching of the Bhagavad Gita. Discussion. We mentioned that syphilis or destruction is due to the action resulting from the corruption of emotion and thoughts. Conclusion. The correlation between the Srimad Bhagavad Gita and homeopathy suggests that disease arises from the corruption in will and understanding, establishing a common understanding of the origin of disease. Thank you to Father Muller Homeopathic Medical College to this opportunity. Thanks to my parents to inspire me. Thanks to Gadi Vidyapith, LR Shah Homeopathic College to support us. Thanks to our principal Bhaskar Bhatt sir, Arvind Bhatt sir. Thanks to academic in charge Vivek sir for their support, and thanks to my guy Amit sir and Rishi sir. Thank you.
Judges kindly note, the time taken by the presenter was 3 minutes 26 seconds.
Go back to the discussion. Can you show your literature search? What you have done in the beginning, introduction. Have you done any literature search on this? Okay, next slide. Next one. Yes. Okay, suppose you consider the homeopathic principles.
Yes.
Spiritual part is one part of that. Scientifically, if you look at the homeopathic treatment being given for syphilis,
Yes.
how it is done?
So, all the people are disease originate from the will, corruption of will and understanding.
Okay.
So, patient are suppress their will and understand. So they are affected with diseases. So they are not well.
Because if I have understood well, homeopathy is a holistic system where multiple factors are taken into consideration when you go for diagnosing or treating the disease. Am I right?
Yes.
Okay. And the discussion is not adequate here. Because without solid, after all, it is scientific research. Okay, definitely there is a role for spirituality and other things. I am not telling that. But you should put sufficient literature on that. You have discussed a few, which is not adequate to come to the conclusion. I am not refuting your claims, okay, of definitely with the great regards to the Bhagavad Gita as well as the homeopathy system. But when you derive a conclusion, you should have a solid literature background which should be presented here. That's what I feel. But the concept is excellent.
Thank you,
and
sir.
a confident presentation.
Thank you, sir.
Yeah, Disha, I must congrats for something new where you are trying. Only one important question is you have directly jumped to the syphilitic miasm,
Yes, sir.
right? When we talk of a evolution of a disease, it starts from the sori.
Sorry.
So it is always advisable to start with the soric because when the changes take place at the level of thought, feeling, action, and same way the Bhagavad Gita has also said,
Yes.
destruction will come quite off late. Okay, so take care of it, and it's definitely a good topic, and all the best for future because it's really interesting.
Thank you, sir.
Hi, Disha.
Hello.
Very interesting and unique topic. It's a great attempt.
Thank you.
So, but if there were more discussion,
Yes.
if you had added more information to the discussion section, how did you compare and contrast?
Yes.
What is exactly mentioned in the Srimad Bhagavad Gita? What are the phrases used? What are the terminologies used? And how miasms are represented in the Bhagavad Gita? And what does homeopathy talk about miasm? And what is the extent of spirituality? How do you measure spirituality in Bhagavad Gita? And how do you measure spirituality in homeopathy? Because homeopathy is not a religion, as you and me understand, right? So when we say research, research involves critical thinking. We don't question our religion, we don't question our holy books. But when it comes to research in biomedical research, it starts with questioning, critical analysis, evaluating, measuring. Yeah. So it's a very interesting topic, what you have attempted, but a little more justifications and a little more comparisons, like compare and contrast.
Yes.
I think so. There definitely be limitations about what is mentioned in the Bhagavad Gita and what is mentioned in homeopathy. So homeopathy can, according to me, I don't think it can be, directly. You cannot say this is exactly what is mentioned in the Bhagavad Gita, right? There will be, because Bhagavad Gita has lot of spiritualities and messages, but in homeopathy we are trying to evolve the system day by day. It just evolves. I have a different understanding of the miasm, and you may have a different understanding. Yeah, so more of justifications, but excellent. You have gone in a very systematic manner. You have incorporated all the steps involved in research. Yeah, so these are things. All the best.
Thank you, ma'am. Yes. Thank you, sir.
Ms. Niharika, your time starts now.
Good morning. This is Niharika from MNR Homeopathic Medical College. My topic, the research I was conducted in 2021. My title was A Brief Study to Know the Efficacy of Ailanthus glandulosa with Oral Hygiene as an Adjuvant in Treating Acute Tonsillitis. As we know, tonsillitis is a usually has been linked to life. I have taken Ailanthus glandulosa because it is having a sphere of action on the tonsils with a symptom like irritating the patient because of frequent occurrence of tonsils and angry looking ulcers with deep seated where the pain radiates from the tonsils to the ears. Because of this, I have chosen the Ailanthus glandulosa and oral hygiene. Review of literature suggests that poor oral hygiene is the main cause for occurrence of tonsillitis. This is the main motto to select the Ailanthus glandulosa and following with oral hygiene for treatment of tonsillitis. My aim is to know the effectiveness of Ailanthus glandulosa with oral hygiene in acute tonsillitis. Objective, to know the importance of Ailanthus glandulosa in management of tonsillitis and to know the importance of Ailanthus glandulosa along with oral hygiene in management of acute tonsillitis. Before conducting my study, I was taken the ethical clearance form, then consent form from the patient, and also confidentiality was maintained. Before conducting, I was screened nearly 100 patients from where I was selected with symptomatology and clinical examination. I got 50 subjects with suffering from tonsillitis. From considering inclusion and exclusion criteria, 30 subjects were selected for my study. The symptoms of the patients was assessed by STAT questionnaire. Then the prescription was given according to the groups. Group A consists of only the medicine. That is, I have prescribed only Elianthus. Then group B, I have prescribed medicine and also with the oral hygiene suggestions. My hypothesis, the H0 is no significant difference in using oral hygiene and also the medicine. And research hypothesis, there is significant difference in using oral hygiene along with the medicine. Then results were analyzed. My questionnaire consists of parameters like episodes of tonsils, meeting the physician, culture of throat, episodes of missing school, antibiotic treatment, episodes of fever, episodes of halitosis, and episodes of swallowing. These was the parameters in my STAT questionnaire. On the basis of these parameters, the effectiveness of Elianthus glandulosa and oral hygiene is assessed. Inclusion criteria. The patients are taken of age 8 to 40 years from semi-urban areas with symptoms of tonsils of both sexes irrespective of socio-economic status. Exclusive criteria is patients who are undergoing treatment for any chronic diseases will not be considered. And my study includes suggesting the oral hygiene who are suffering with tonsillitis. Then I have suggested them have a brush twice a day and gargle with warm water when we are having the episodes of tonsils, and also use mouthwashes before going to sleep and avoid smoking during the episodes of tonsils. These were the suggestions which I gave to the group B. The results were to be both the medicinal group and medicinal with oral hygiene group have shown the results. But my study is to know, as we know that Elianthus glandulosa is having the effect on tonsillitis. But my study is to know, along with the oral hygiene, along with the medicine, how oral hygiene is going to help from reducing the effectiveness and frequency of tonsils. The parameters was analyzed by using Petty test with the p-values. Study design focused on comparing the effectiveness of Elianthus glandulosa in curing tonsillitis against a group practicing oral hygiene, with finding indicated that oral hygiene was more effective than medicine alone. And for my study, I have used Dr. Burnett in his book Enlarged Tonsils Cured by Medicine, gave many examples like how he was treated in his cases. Like I have taken other review of literatures from other studies like homeopathic management of tonsillitis in pediatric age group done by Shilpa Jain says that the poor orodental hygiene and poor nourishment causes tonsillitis and treated with belladonna and calcarea carb. Characteristics of age and oral hygiene status on palatine tonsils done by Thayas IR, relationship between the bacteria in oral cavity in process of occurrence of tonsillitis. Next, another review of literature which helped my study is there any association between the oral hygiene and development of tonsils by Aditoyo, who demonstrated poor oral hygiene is leading cause of tonsillitis. Conclusion, Elianthus glandulosa effectively treats tonsillitis, especially when combined with oral hygiene and outperforming medicine alone. Most affected group in my study was 10 to 20 years of age. Most improved symptoms were sore throat, halitosis, and reduced antibiotic usage. And we have an idea that Elianthus glandulosa is treated. But why I have taken the group B, medicine with oral hygiene, was with medicine alone, with the symptomatology matching, only 4 parameters or 4 parameters were improved. But group B, all the parameters according to the STAT questionnaire was improved. This was my conclusion, and I can say that along with oral hygiene, medicine both have improved and satisfied all the parameters, so that only medicine can, because here we have some clinicals cases like lumbar spondylosis or something, where we have to management not only with the medicine but also with other. Then I deeply acknowledge the people who have supported me in this study and my college principal and my guide. And also I would like to thank the Potentia team and Father Muller College. Thank you so much.
Judges kindly note the time taken by the presenter was 7 minutes 17 seconds.
Really good topic. The basic question which comes. Were there any study which can able to focus only oral hygiene can take care of a recurrency of a tonsillitis?
No, sir. No, sir. Along
Because
with medicine, oral hygiene should be suggested.
no, my question. So if suppose only patient were kept on oral hygiene, what could have been a outcome?
I
That is
have
the
not
first question.
suggested, sir. Because
Second,
I have chosen the topic is acute tonsillitis. I can't make the patient to wait because he is such a intensity he will be suffering. So what I have taken is two groups, that is compulsory medicine should be suggested to the both the groups. But another is I have suggested oral.
okay. Now another important point, when you talk of acute tonsillitis, we do take care how of a susceptibility plays a major role. So you were able to find out the comparison with a ODP and the impact of the medicine, because that is a very essential part.
Yes, sir.
How you were able to judge that? Because if the frequency has been taken care or no, what were the out?
Frequently occurrence. But according to my questionnaire, I have taken the assessment for 15 days, sir.
Sorry, assessment for
Sir.
how long you have continued frequency of an attack? How you will able to judge that this?
Yes. How did you take consent?
Consent sheet was given from our college that we have to take from every patient. Consent sheet was given from our college that we have to take from every patient before giving any prescriptions.
To do this research and to include them as participants of your study, whether a separate consent was taken.
Yes, sir. I have
Or
taken
it
from
is
every.
the routine consent what you take in a hospital setup.
No, sir. We have taken the sheet and we made them to sign on that.
Okay. What are the components of that? Informed consent documents means what? What all was there? Only one sheet where they had to sign or any other
No,
material?
sir. Only sheet.
Did you provide them a participant information sheet where all the details were there and you handed over to them that to
We
read?
didn't give them, sir.
Hmm?
Only,
Given.
only the consent sheet was only one paper that with my title I'm going to take like this and I'm going to treat, I'm going to do research on you. That sign was done with every
You had
patient.
children also in your study, right?
Yes, sir.
Whether their consent was taken, assent was taken
No, sir.
separately.
Their wardens were given. We have went for schools, hostels, sir.
Okay.
Wardens were given.
So who gave the consent for those children in the school or
Wardens.
hostel? Warden. But not from the individual children.
No, sir.
Parental consent?
We told wardens to inform the patients.
But you did not take from parents. Parental consent is mandatory. And 12 to 18 parental consent is sufficient.
Nice presentation. When you do such studies involving both pediatric as well as adult population, you need to have separate set of criteria for both population. Like how, as Sir said, with regard to the consent, the inclusion criteria. So you mentioned in the exclusion criteria that patients with other chronic diseases will not be included. How about tonsillitis? What are the types of tonsillitis? Do you have acute and chronic?
Acute and chronic, I have taken only acute one, ma'am.
Only acute tonsillitis. Okay. And what are the other causes of tonsillitis?
Like,
Is it only because if the a patient is not proper, follow proper oral hygiene, then there are chances of getting tonsillitis?
because, yes, ma'am. Not only oral hygiene, because of taking the colored food items or Like that also there is an effect on tonsillitis.
Okay. And can you go to your first slide? Your aims and objectives. Yeah. So very good that you have differentiated aim and objective. I've seen this only in your presentation. So when you write the aim, you should start with to determine the effectiveness. Yeah, so the use of verbs are very important in aim and objectives. And never use the term know or to examine and things. Use verbs like to determine, to understand, to evaluate, to assess. So these are the verbs you have to use. Okay.
Okay.
And in one of the slide, you instead of writing assess, you had written access. The access is different and assess is to examine something. Yeah, access is to get something. Yeah, and with regard to your sample size, was there any calculation done? How did you get the number 30?
No, sir. No, ma'am. Just we have taken the help from our guide and researcher, statistician. Like they will be present of 30 and 60, ma'am suggested. Then I can't get the sample size more than 30, so I have chosen the 30.
Okay. Yeah. And in the discussion section, you had cited few authors.
Yes, ma'am.
So that should go to the literature review in the beginning,
Yeah.
after the introduction. So these things, what you have cited in the discussion, the previous research studies, these are right. Yeah, so this should go to the beginning, not in the discussion. Even in the discussion, you can say that other studies are also matching your research, but the main literature review should go to the beginning of the presentation. And when you're writing the authors' names, for example, Shilpa Jain, you should write their surname, not the full name. Yeah, so Jain, comma, year of publication. So that's how you cite the names of authors. Okay, very good, thank you.
Thank you, ma'am.
I invite the eighth presenter, Mr. Uday Chetan Bhai Chandrana, to the stage. Your time starts now.
Good morning, respected teachers, dignitaries, and one and all present here. Myself, Uday Chetanbhai Chandarana, third year BHMS student of Elasha Homeopathy College, Rajkot, Gujarat. Today in Potentia 2024, I am going to present my topic, modus operandi of homeopathy, nanomedical science. Nanomedical science is a branch which deals with the application of nanoparticle with a medical science. Introduction. As we know that Dr. Samuel Hahnemann developed the concept of potentization by minimize our medicine, that is we decrease the material quantity but we increase its power, because of which medicine is converted into nanomedicine and it is difficult to find any single molecule of medicine. It is done by two processes, succussion and trituration. As we decrease the material quantity, it is difficult to find the single molecule. That's why our homeopathy is being criticized from the scientific world and it is called as a pseudoscience or a placebo science. My aim is to understand the phenomena of cure by nanomedicine or homeopathic medicine. To achieve my aim, I have tried to correlate the modus operandi given by Dr. Hahnemann in aphorism number 29 with nanoparticle allostatic cross-adaptation time-based sensitization model. My study design is a fundamental research. I have used two methods for search. First is offline literature search. Second is the online Google search by using the phrase nanoparticle homeopathy experiment. And by using this phrase, I have taken the NPCAS model from PubMed publication, which was published on January 2013 by Bell and Coythan. I have studied the aphorism number 29th of 6th edition of Organon of Medicine, nanoparticle allostatic cross-adaptation time-based sensitization model, and tried to make the analytical review of aphorism number 29 and NPCAS model. So I came to the result that normal allostatic network or vital force in health, according to the Dr. Hahnemann, get dearranged or malfunctioning of allostatic network by a higher intensity stressor or causa morbi, according to the Dr. Samuel Hahnemann. When a low intensity stressor or a homeopathic similimum, according to the Dr. Samuel Hahnemann, administer upon the tongue, it tried to reorganize the living system or restore the health, according to the Dr. Samuel Hahnemann, by two methods, hormesis and metaplastic bidirectionality, or primary action of medicine and secondary curative action of vital force, according to the Dr. Samuel Hahnemann. I have came to the discussion that as our Dr. Samuel Hahnemann tells us that when we administer the homeopathic similima upon the tongue, it acts through the sentient nerves. Like same way, the Bell and Coython tells that homeopathic medicine is in the form of nanoparticle which act through synapse. When a high intensity stressor comes in the body is causes the neurochemical imbalance in which it decreases the calcium and acetylcholine level. The calcium and acetylcholine level is the main chemical which helps the brain to provide its signal. When acetylcholine and calcium level is decreased, the brain receives the low signal, thus decreasing the capacity to fight against disease, and thus malfunctioning of the allostatic network occurs. When a nanoparticle or a homeopathic medicine is administered upon the tongue, it acts on the synapse and produces the reverse condition, that is, it increases the acetylcholine and calcium level, thus increasing the capacity to fight against the disease and reorganizing the living system. This is done by the two processes known as hormesis and metaplastic bidirectionality. Thus, with the help of NPCS model, we are trying to understand the concept of modus operandi of homeopathy, and as we can correlate it with aphorism number 29, we are concluding that homeopathy is not a placebo science. At last, I am thankful to Father Muller Homeopathic Medical College for giving me this opportunity. Gadi Vidyapit, Elarsa Homeopathy College, Dr. Arvind Bhatt sir, Principal Dr. Bhaskar Bhatt sir, for their constant motivation and support and providing the environment for research. Academic in charge Dr. Vivek Masoya sir for his motivation and for explaining the importance of paper presentation. My mom and dad for their blessing and support everywhere. Dr. Rishi Srivastava sir for enlightening me about Potentia 2024, for helping me in preparation and for his constant motivation and support. My guide, Dr. APS Chhabra sir, for his supervision and guidance in research project and preparation of abstract and presentation. Dr. Piyush Jinjuwadia sir and Dr. Amit Pachegavkar sir for his guidance. No conflict of interest and no source of funding is required. Thank you.
Judges kindly note, the time taken by the presenter was 5 minutes 42 seconds.
Very bold presentation.
Thank you, sir.
Congratulations for that. Bold
Thank
and very clear.
Thank you, sir.
And good review also. Okay. What I would suggest is we should take up some original research. Okay, to validate. That's all. Nice.
Thank you, sir.
Hi, Uday.
Hi, ma'am.
Yeah, excellent presentation.
Thank you, ma'am.
It was very clear. But can you tell me what you mean by offline literature search?
Means I have used the book, that is 6th edition of Organ of Medicine. So I have written it as offline literature search.
Okay, so that means which is not published, right? Which is not published online.
Sorry, ma'am.
So do you mean the literature which is not published online? Which is not published in journals?
No, ma'am. I have used the reference of Organ of Medicine for offline literature search.
Okay.
And I have taken the article, which is the testing NPCAS model for effect of homeopathic remedies from PubMed Central. And it was proposed by Bell and Coython in January 2013.
Okay. So instead of writing offline literature search, you can use the word grey literature
Okay.
in
Okay,
such
ma'am.
cases. Okay? Yeah. So it was very good.
Thank
So
you.
as sir suggested, a little more in-depth
Yes, ma'am. I will.
research into
I
it.
will conduct.
Yeah?
Yes.
All the best. Keep up the enthusiasm.
Thank you so much, ma'am. Thank you. Thank you. Thank you, sir.
I now request the ninth presenter, Ms. Saeeda Safa Samreen, to the stage. Ms. Saeeda, your time starts now.
Good afternoon, everyone. I am Seda Safa Samreen, studying in 4th BHMS, the principal investigator of a single blind randomized controlled study to endeavor the efficacy of Wiesbaden 30C in the management of Telogen effluvium under the guidance of Dr. Shilpa Patil, who is an associate professor in the Department of Repertory and Case Taking at MNR Homeopathic Medical College and Hospital. Telogen effluvium is an excessive hair shedding disorder which occurs after any physical or mental stress. The physical stresses such as any chronic diseases or after postpartum or after any nutritional deficiencies and after any mental stress such as psychogenic stress which plays an important role. The normal hair growth cycle includes 3 stages, namely anagen phase, which is the growth phase, catagen phase, which is the transition phase, and the telogen phase, which is the resting phase. In telogen effluvium, the hair follicles abort the anagen phase, that is the growth phase, and they directly go into the telogen phase, that is the resting phase, and they shed simultaneously. I have taken up this study especially on telogen effluvium because it is highly prevalent in the society and often it leads to social anxiety. The existing treatments may carry side effects and it prompts the need for safer alternatives such as Wiesbaden. Wiesbaden, as mentioned by Boric in Thousand Remedies, he commented that Wiesbaden is very much helpful for the growth of scalp. It causes growth of new hair which is darker and thicker than before. Aims and objectives. The aim of this study is to determine how effective Wiesbaden is in treating telogen effluvium, and the objective of my study is to determine the efficacy of Wiesbaden in telogen effluvium through hair pull test. Methods. The methodology I have included is single blind randomized controlled study. So the study design is randomization and the sample size for my study has been 60 patients. The inclusion criteria involved individuals aged around 17 and 30 years and males and females having positive hair pull test. The exclusion criteria involved participants, individuals having sensitivity to the study products and people using any other hair treatment such as minoxidil application, etc. And patient having any chronic illnesses such as cancer or those who are undergoing therapies such as chemotherapy or radiotherapy, etc. The methods used. 200 participants belonging to MNR Homeopathic Medical College, my friends and my relatives who were facing hair fall issues were undergone the hair pull test, out of which 60 participants were having severe hair fall with the hair pull test being positive. They were randomly allocated using odd-even method and they were divided into group A and group B. The odd ones were divided into group A and the even ones were divided into group B. The group A was the medicine group in which Wiesbaden was administered once a week for 4 months, and group B was the placebo group in which the placebo was administered once a week for 4 months. Then monthly assessment was done using hair pull test and the efficacy of Wiesbaden was tested. My results were statistically analyzed, which null hypothesis has been rejected and my research hypothesis has been accepted. This is the graph which represents the effectiveness of treatment in the Wiesbaden 30C group. I have taken 30 participants, out of which 23 cases showed the effectiveness of Wiesbaden. 5 participants dropped because they were having excessive aggravations, and 2 participants still persisted as the same. These two graphs represent about before intervention and after intervention. Before intervention in both the groups, 30 and 30 cases were positive with hair pull test. And after the intervention in Wiesbaden, only 2 cases were having positive hair pull test and others were not having positive hair pull test. Whereas the placebo group had 26 people with positive hair pull test. Discussion. Many studies have stated that females had more frequency of hair fall. Many studies have stated that there is no gender discrimination, but through my study, I have noted that females have got more tendency for hair fall. And I have also noted that 18 to 25 age is the most affected age group. So from this, I have concluded that Wiesbaden is effective in the management of telogen effluvium. And scope for further study can be done using a larger sample size, using different potencies and different routes of administration. I am thankful to acknowledge the participants of my study. I extend my sincere appreciation to MNR management. I'm grateful to Father Muller Homeopathic Medical College for providing me with the opportunity to present my research. The source of funding for this project has been self. There are no conflicts of interest in my project. Thank you.
Judges kindly note the time taken by the participant is 5 minutes 37 seconds.
Congratulations. One important point which I would like to understand, when you have excluded chronic disease, right? Individual is suffering from chronic disease. And when you talk of a cause, you have mentioned about the various medicinal causes. So how you are able to clarify that aspect? Because do I understand that hair falling is a acute criteria?
Pardon, sir?
Do I understand the hair falling is a acute in that sense?
Yes, sir. Acute.
Are you, are you sure? Of a cause, earlier you have said of a cause, there are 3 causes which you have vividly described, right? And from that cause, you are putting the group in a excluding criteria is a chronic disease. Now, how you are able to justify your research?
I have properly taken the case, sir. So from the history of the case, I got to know that a few people were having chronic diseases such as hypothyroidism and all. So I did not include them in my study as they were already undergoing treatment for that.
That is one of the aspects. There are a number of other diseases. Okay, you have said of a nutritional. So either any nutritional deficiencies there, then
If they are undergoing any treatment other than this, I would not include them into my study.
that I have understood. That I have understood. Another important point, how can you justify your result when the cause is different? Because you have talked of a psychiatric from anxiety to the various illnesses, right? So how can you justify that? Okay, Vespidin 30 is useful in all the cases because each disease have their own parameters of improvement, having an impact. Growth of hair. Cause are different, right? So each cause have their own ramification on an individual, on a development of a growth of hair. Remember, if the person is suffering from anxiety or suffering from depression or any psychiatric illness, right? The cause impact of a hair falling will be different, right? If individual is suffering from some other disorder, what you have talked of a psychosomatic or a any other disease, the impact will be different of a hair falling. And how you are able to justify that Wiesbaden 30 is helpful in all the cases?
Okay, excellent presentation. See, further to clarify, you should have worked well with your inclusion and exclusion criteria. Some more homework should have been done. Thorough literature survey, then it would have been a properly controlled study. Okay. And 200, what was the basis for your sample size?
60, sir.
Yeah, how you worked out that number 60?
Odd even method. I have allocated them using the odd even method.
Correct. Why 60 only? Like previously also we asked for one of the candidates. See, this type of studies, you should work on the sample size calculation.
Okay, sir.
You should show that here, and it is not just some number of 20, 30, 40. It should be scientifically calculated. Okay.
Okay, sir.
Then it will validate your result. That is the way to do. And you had only one group, right?
Two groups, sir. A medicine group and a placebo group.
Okay, placebo group was it. That's why paired t-test, unpaired t-test was used.
Yes, sir.
Okay. So with the same medicine group, before and after treatment, how did you compare? Any statistical test?
Hair pull test I have done, sir, before
Correct.
and after.
Statistically, how did you analyze? There are two study groups, right?
Yes, sir.
What are the two study groups? Can you go to that methodology again? Yeah, group. Yeah, go back. Yeah, group A and group E. Okay, placebo group. Fine. Next. My question is, go back. Group A, before and after treatment, how did you analyze statistically? What statistical tests you have used?
Unpaid t-test I have used, sir.
Unpaired t-test will be used to compare between two groups. Say if you want to compare between placebo group and the treatment group, then you can use unpaired t-test. Same group participants before and after treatment, if you want to compare, should use a paired t-test. Right? Am I right?
Sir, as I was having unequal variables, like in the beginning I had 30 participants, but at the end of the study, a few people dropped out. So as I was having unequal variables, I have chosen unpaid t-test, sir.
Should have been some other statistical test. If t-test is not applicable, then some other. Okay. Was it approved by an ethics committee?
Yes, sir, it was
Which institutions ethics committee?
from my college. It was approved, sir.
Yeah. Which its institutional ethics committee had approved it? IEC.
Yes, sir.
You made a presentation in an IEC.
Yes, sir, I did.
Okay, good.
After
How was
that,
the consent taken? Consent.
the participants were informed about this study, sir. Then after their approval, I have added them in, like I have taken up them for the study.
Which language you used in that?
Their own mother tongue I have used, sir.
Which mother tongue now you used there?
Telugu.
Okay, so you had a participant information sheet and consent form in Telugu.
Yes, sir, we had both in English as well as in Telugu.
Okay.
Hi, Saida.
Hi, ma'am.
Yeah, nice presentation. You have included all the sections systematically. I'm happy with that.
Thank you, ma'am.
But I'm a little confused with your numbers. Like, overall, how many patients did you include for the study?
60 was my sample size.
60. And what is 200? Have you written 200 somewhere?
200.
Yeah.
200 participants I have screened.
Okay, that was screening. So it was 60. Okay. So what was the sample size approved by the ethics committee?
60 they approved, ma'am.
They approved 60 and you got 60. And how many dropped out?
From medicine group, 5 dropped out, ma'am, and from placebo, 2 dropped out.
So 7 altogether. Okay. And your p-value is less than 0.05. So how did you arrive at that value? What was the exact value?
It was around 0.02, I guess.
Have you put it in the slide here? Because that's very important. Certainly, because you have mentioned the formula and the second line, it is straight away p-value less than 0.05. So what happened in the between is not shown. So that's very important. Otherwise, the data goes invalid.
Okay, ma'am.
Okay. Yeah. Otherwise, very good. Thank you.
Thank you, ma'am.
invite the 10th presenter, Ms. Shweta Srivarma, to the stage. Your time starts now.
Good afternoon, everyone. This is Svetashri Verma Lakkamraju, final year BHMS student from MNR Homeopathic Medical College. Today, I'm here to present my research, that is Thuja occidentalis 200CH, a promising LA in the battle against Lucinodes orbonalis in Solanum melongena. What is Solanum melongena? It is a scientific name of brinjal. In Kannada, we can call brinjal like badanakai, and we know many varieties of brinjals, but for this research, a Chinese brinjal that is long, slender and violet, where you can see in the picture, was adapted. And we all know the most common disease that is affecting brinjal is Lucinodes orbonalis. What is Lucinodes orbonalis? Till few years back, whenever we cut the brinjal to cook food, we used to find some larval borers. Those are Lucinodes orbonalis. But nowadays, we rarely find that borers. Why? Because farmers adapted chemical pesticides to eradicate these Lucinodes orbonalis. These chemical pesticides not only harm the borers but also us humans and environment. Because of that, in my research, Thuja occidentalis 200CH, a homeopathic medicine which can affect and eradicate borers from the plants, has been taken. This statement is given by Dr. V.D. Kaviraj. My aims and objectives are to verify the efficacy of Thuja occidentalis 200C in eradicating borers and to provide eco-friendly, non-chemical and healthy brinjal yield to the public, and also to make it cost-effective in farming. For my research was conducted in MNR Homeopathic Medical College premises in a greenhouse with good sunlight and ventilation. For my study is an experimental study where the inclusion criteria is healthy saplings and the exclusion criteria is unhealthy stunted saplings. My sample size is 30 plants where each group contains 10 plants. That means 3 groups. One is intervention group where I use Thuja occidentalis liquid, just 5 drops per liter and 50 succussions. This method was applied in 4-hour spray once in a week for 2 to 3 weeks. And for reference group, I took chemical pesticides like thiamethoxam and imamectin benzoate, same as other farmers. And for the reference group, I used placebo. And these pictures show the journey of my research from sowing, sapling, and the day of transplantation into the pots and plants after a month. I used hand pollination method as this brinjal plant is a bisexual plant where it have both male and female flowers, and I induced the disease mechanically in flowering stage. These are the plants before treatment and after treatment, and the healthy fruits where the fruits are diseased. This is the first harvest. I did two harvests from each group, and that is the measuring yield. I measured all the parameters every month on the same day. The table here represents the parameters that I took for the research and also the results of the research. The result says that Thuja occidentalis and chemical pesticides have more effectively reduced the borers compared to control group. But Thuja occidentalis group, where the intervention group gave more yield, more healthy fruits, less damaged fruits, and more shoot height compared to chemical group and control group. This graph also represents the parameters and variations in the different groups, where orange bar represents the percentage of damaged fruits and each and every group. For my research statistical analysis, I subjected the results to ANOVA test, where F ratio is more than the table value and P value is less than 0.05, that the actual value is 0.01. Hence, the research hypothesis is supported and null hypothesis rejected, which says that Thuja occidentalis is effective in reducing the Lucinodes organolis in brinjal. The points to be discussed is effectiveness of Thuja occidentalis on plant growth and yield, which is more compared to chemical pesticides. The fruit quality is good in both chemical insecticides group and intervention group, that is Thuja group. But it also, the chemical pesticides are harmful to the humans also with the minimal health risk. And for agriculture significance, in India, there is 1.4 million small and medium farmers were cultivating brinjal crops. So, this research may help them to be the cost effectiveness and to give more economical output. With this research, there are more further research opportunities and practical implications. With this, I conclude that Thuja occidentalis 200CH is effective in eradicating borers and enhance yield, giving more economical output and cost effective. On an average, every farmer is spending 30,000 rupees just to buy chemicals and spray on the acre of brinjal plant. But with homeopathic approach and with this study, we can reduce the expenditure to just 3%, that is 900 rupees, where the farmer can buy the Thuja occidentalis liquid potency and then they can use to the 1 acre of brinjal plants with foliar spraying. But for the more understanding and more approval, large scale studies can be provided. And my sincere gratitude to my principal, my guide, Dr. Gayatri Prasad sir, and my director sir. And also I thank Potentia team and Father Muller Homeopathic Medical College for giving me this opportunity. Thank you.
Judges kindly note the time taken by the presenter was 6 minutes 22 seconds.
Actually, a good study.
Thank you, sir.
No other comments. But everybody is telling future larger studies are required. I think you should take it forward somewhere.
Yes, sir.
You are a postgraduate.
Yes, sir. No, sir. Just I'm final year student, but I am doing it in large scale. Like I am tied up
I
with.
think your postgraduate dissertation and as a faculty also you should continue it.
Yes, sir.
Because
Yes, sir.
this is very helpful.
Yes.
Okay. Thank you.
Thank you, sir.
I now request the 10th presenter, Mr. Ponnaganti Venkata Ramanachari, to the stage. Your time starts now.
Good afternoon, everyone. My name is PVR Chari, and I am from MNR Homeopathic Medical College and Hospital from Sangareddy, Hyderabad. So let's get into the study. My research paper was on comparative study on efficacy of Anacardium oriental and bismuth in non-ulcer dyspepsia management using GAS score, gastrointestinal symptom score. So as there were a current scenario, there are more patient increase in non-ulcer dyspepsia cases, impairing health-related quality of life in patients. So it impacts their major variables of quality of life, namely mental, social, and physical functioning. Our medical literature showed Anacardium oriental and bismuth indications well in nausea, vomiting, stomach pain, burning, bloating, eructations, slow and weak digestion, and acidity sickness, which are the major symptoms of non-ulcer dyspepsia and were unexplored in our clinical practice. So my aims and objectives, this study aimed to evaluate and compare Anacardium oriental and bismuth in managing non-ulcer dyspepsia, assessing the improvements via gastrointestinal symptom score. So this was the score. Actually, this was taken from one of the research article. I will provide the citation for that. And this was taken from that research which is happened at West Baden, Germany. So they created this all this nausea, vomiting, bloating, abdominal pain. These are the scores, and the scores ranging from 0 to 4. 0 is less severe, then there are no symptoms at all. But 4 is more, severity is more. And if you see that nausea, vomiting, bloating, and abdominal cramps, these are patients with more severity. They feel more pain with these symptoms. But when it comes to the sickness, lack of appetite, and retrosternal discomfort and epigastric pain, these are at initial level when the patient started with the disease condition. So the source of data is this study was carried out on 30 patients attending MNR Homeopathic Medical College and Hospital, Fasalwadi, Sangareddy, Telangana. Sampling procedure for the study, patients were selected randomly. The study design was randomized comparative study. And the methods, the present clinical study was conducted in MNR Homeopathic Medical College and Hospital. The patient was selected as per inclusion criteria. Among 30 cases, 15 patients were prescribed anacardium and other 15 patients were prescribed with bismuthum, followed for a minimum duration of 6 months. The result obtained has been statistically analyzed and evaluated by paid tests and unpaid tests both to determine the efficacy of anacardium, oriental, and bismuthum in the treatment of non-ulcer dyspepsia with the improvement of health-related quality of life as a criteria. So inclusion criteria. I included the individuals aged between 18 and 60 years. In the case of women who are non-pregnant and not lactating, patients who are having at least 5 of the following symptoms: nausea, vomiting, bloating, abdominal cramps, early cystitis, and acid eructations, loss of appetite, and retrosternal discomfort, epigastric pain. I'll include the patient who are having crossed more than 5 symptoms. Exclusion: patients with a history of gastrointestinal surgery, peptic ulcer, gastroesophageal reflux disease, gastric and esophageal cancer. Almost I screened 60 to 70 patients. In those 5 patients, we sent to upper GI endoscopy and other abdominal scannings. 4 to 5 patients having severe pathology in their upper GI tract. So we excluded those patients. We take only the patient with the functional level of symptoms only. So other infectious systemic diseases associated with alarming symptoms such as gastrointestinal hemorrhages and any medications were excluded from the study. Pregnant or not lactating females were also excluded. So anacardium group, out of 15 patients, 10 patients, almost 66% showed marked improvement in well-being along with the improvements in health-related quality of life. 5 patients were showed no improvement at all. In bismuth group, up to 15 patients, 11 are showed marked improvement. It is almost 73% in well-being along with the improvement in health-related quality of life. 26% showed no improvement. So anacardium oriental was bismuth. So based on the unpaid TCS results, anacardium oriental and bismuth is evident. The bismuthum showed more efficacy compared to that of anacardium oriental in the management of non-ulcer dyspepsia, improving health-related quality of life. If you see this graph, and this orange one is showing the efficacy of bismuthum, and this blue one showing the efficacy of anacardium. If you see the value of p-value, that is p-value is 0.0353. By conventional criteria, this difference is considered statistically significant. And there are some values, mean values and standard deviation, standard error, mean values. And let's come to the discussion. Based on anacardium oriental and bismuthum medical literature, the study was done to provide the solution for the research questions, which was their unexplored potential ability in the management of non-ulcer dyspepsia, along with improvements in quality related to life. So anacardium oriental and bismuth offers promising outcomes in the managing the non-ulcer dyspepsia, significantly improving the patient health. Bismuth particularly showed superior efficacy compared to that of anacardium. Use this. I sincerely acknowledge my principal and director sir and my college, my guide Pavitran sir and assistant professor, Department of Homeopathic Pharmacy, and it's an honor to me to be present here. I thankful to Team Potentia and Father Muller College for giving this wonderful opportunity. Thank you very much.
Judges kindly note, the time taken by the presenter was 6 minutes 15 seconds.
Yeah, really interesting topic. What were the potency which you used?
200 C.
200 both, anacardium and
Yes,
bismuth.
both 200.
Okay. You were able to take care of other parameters which can lead to a development of non-acid peptic disorder?
Yes,
Because there are a number of
yes,
factors
sir. There are
which
so many
plays a
cases.
major role.
Yes,
Now,
sir.
how you have included in your research?
No, sir. Some of the patients with having a history of smoking, some of the patients having a history of NICDs, non-steroidal anti-inflammatory drugs, those things we excluded, sir.
No, I'm talking about a simple dietary care.
Dietary care, sir, yes, sir.
That is not available when you write
yes,
down
sir.
about your when
Due
you
to
have
lack of
press.
space, I am not providing those data.
Because
Actually,
diet plays a major role in non-acid
yes, sir,
peptic
I am,
disorder, right?
yes, sir, I am
So if it has been taken care, what role your medicine has, how your medicine was effective? That was a very, very
yes,
important
I am
aspect.
accepting that, sir.
Okay. Thank you.
Hello. Nice presentation.
Thank you, sir.
Was this a pilot study? No, you selected 30
Yes.
participants, divided them into two groups of 15 each.
Yes, sir.
So you did not get any previous study for this, previous research?
Sir, there are previous research on non-acid dyspepsia, including bismuth also, but not in homeopathy. There are other researches on conventional system of medicine. They are using crude drugs, only bismuth in milligrams, micrograms. But in our homeopathy, we are diluted to a
Fine.
potentized.
So this is like a pilot study.
Yes, of course.
Did you consult a statistician
Yes, sir, we consulted.
before making that number of 30?
No, sir. Actually, I got almost 65 patients. In that I screened, I got only 30 to 35 patients. In that, some of them have severe pathologies and some of them have a history of smoking. We excluded those patients.
No, when you arrive at a number, there is
Yes,
some basis for that.
Yes, sir.
Either you can do as a pilot study, no harm. Suppose this itself can be taken as a pilot study. Based on the findings of this, you can derive a sample size,
Yeah.
do a bigger study in the future.
Yes, sir.
That's
I
what,
actually am interested. Everything is mine, sir. In my opinion, personal opinion, everything is mine, and I want to conduct the study how this non-acid dyspepsia, maybe how this psyche may cause the disease in soma level, how this mind will affect the body in future. Maybe if at all I get a chance, I will conduct those experiments, sir.
no, your intents are good. The concept is excellent. Only thing is when you follow the methodology, follow scientific methodology where statistically
Yes,
you decide the sample size and do it,
Okay, sir.
that will lead to a very good result,
Thank you,
valid result. Okay, thank you.
Thank you so much.
Hi, Venkat.
Hi.
Excellent presentation. So at the end, you had written the research question bought so-and-so solution. So what was the research question?
Research. I don't get your question.
Just go back to your slide on discussion. The last slide. Not this. Yeah, the third line. The study was done to provide a solution for the research question, which was there, unexplored potential.
Yes, ma'am. The question is actually.
This was not clear to me. Yeah.
Yes.
What do you mean by this? It was the study was done to provide. Do you mean your study or some previous studies?
No, ma'am. My study only.
Your study.
My study only. This why actually other remedies are there to help to announce the dyspepsia cases. Bismuth was used, but it was less frequent. So if at all we explore those conditions, it will help the mankind. That's my opinion.
Yeah. So when you write, you have brought a solution for the research question at the end of the study. The research question should have been written in the beginning as well.
I will accept.
Yeah, so please note that. So when you present scientific papers, you first start with a research question. Title is not so important. It's a research question which is very important. Yeah, what you want to find out.
Okay.
And that has a peculiar format as well. We say the PICOT format.
Yes.
The population, what is the population? For example, who are the participants or patients involved? Then what is the intervention?
Yes, ma'am.
Means what are the medicines you bring in for testing? The comparison, whether you have a comparison group. What is the outcome and what is the time bound? So that's called PICOT. And then comes the objectives in SMART format.
Yes.
So SMART stands for specific, measurable, attainable, relevant, and time bound.
Okay.
Yeah. and then you write your hypothesis, the alternative.
My hypothesis were bismuth and anacardium are null hypothesis. Bismuth and anacardium were not effective in treating non-ulcer dyspepsia. Research hypothesis was bismuth and anacardium were effective in showing efficacy in non-ulcer dyspepsia along with the quality of life. And I found that on the way I found another thing, bismuth having more efficacy compared to that of anacardium.
Yeah. So all these should be detailed out in the method section along with your sample size calculation, which is of utmost importance.
Okay.
Yeah. So with this, the study is going to be very good.
Thank you.
Thank you.
Thank you. Thank you.
We have come to the end of the morning session of Potentia paper presentation competition. Potentia poster presentation competition was conducted in the conference hall. The esteemed judges were Dr. Anup Narayanan V, Assistant Professor, Department of Pharmaceutics, NGSM Institute of Pharmaceutical Sciences, NITTE deemed to be University, Dr. Gino Jose, Assistant Professor, Department of Homeopathic Pharmacy, Father Muller Homeopathic Medical College and Hospital, Dr. Skandan S. Kumar, Assistant Professor, Department of Organ and of Medicine, Father Muller Homeopathic Medical College and Hospital. I now request Reverend Father Faustine Lucas Lobo, Director Designate and Administrator, Father Muller Homeopathic Medical College and Hospital, to felicitate the judges. I also request Dr. E.S.J. Prabhukiran, Principal, Father Muller Homeopathic Medical College, and Dr. Raisa Cherian, Convener, Dr. M.L. Dhawale Memorial Oration, to join the felicitation. I now request Dr. Narayanan B, Assistant Professor, Department of Pharmaceutics, NGSM Institute of Pharmaceutical Sciences, NITTE deemed to be University, onto the stage. Dr. Gino Jose, Assistant Professor, Department of Homeopathic Pharmacy, Father Muller Homeopathic Medical College and Hospital. Dr. Skandan S. Kumar, Assistant Professor, Department of Organ and of Medicine and Homeopathic Philosophy, Father Muller Homeopathic Medical College and Hospital.
We shall now break for lunch and resume back at 1:30. Please note, the lunch for the delegates and contestants are arranged on the right side of the auditorium at 1 a.m. I request the volunteers to guide them to the dining hall. I request the rest of the audience to assemble back in the auditorium by 1:25. Attendance will be taken by chief mentors. Please, the lunch for the delegates and contestants are arranged on the right side of the auditorium by 1 p.m.